Thanks for joining us today for our Survivorship special topic. My name's Julie Lanford, and I'm the Community Engagement Director at Cancer Services. We are a cancer support nonprofit located in Winston Salem, North Carolina. And each month we post a special topic video with experts in a variety of areas relating to cancer survivorship and caregiving. And we post these videos on the Cancer Services website, our YouTube channel, and we also put the audio on our podcast, which is called the Triad Cancer Connection. So make sure you subscribe to our channel so you can get the updates when they come out. Our topic today is Integrative Oncology, which is a very popular topic. So I'm very excited to have our expert speaker, Dr. Rachel Baldwin. She is an integrative medicine physician for Novant Health Cancer Institute here in Winston-Salem. And we're excited to have her, and we have lots of great things to talk about. So we're going to jump right in. Welcome, Dr. Baldwin. Thank you so much for being here.
Well, thank you so much for having me. I really appreciate this opportunity.
So let's start kind of with the basics. Can you help us understand what the role of integrative medicine is in oncology care?
Yes, absolutely. So integrative medicine is a holistic, healing-oriented style of care. We like to look at each person as an individual, taking into account mind, body, spirit, as well as all the other factors in our life that affect our physical health. So things like stress levels, family support, lifestyle habits. We don't practice alternative medicine here in the sense that we don't do alternative treatments or regimens for cancer. However, we do have a variety of carefully selected complementary therapies that can help support people through their cancer diagnosis and treatment. In our clinic, we have acupuncture, massage therapy, and yoga therapy. We also, I do integrative medicine consults with people, and during that time, we can discuss things like nutrition, exercise, some herbs and supplements as that's appropriate, as well as mind-body medicine, stress management techniques.
Awesome. So you actually have, I know the yoga classes that are in the office there, they're virtual and in person, right?
Yes, some are virtual and some are in person. They're all free to any member of the community. You don't have to be a Novant Health patient, and you don't have to be a cancer patient. We also do have individual yoga therapy sessions that we offer in our clinic where our yoga teacher, therapist, Angela Gallagher, can do really individualized recommendations based on one's particular health situation, history of surgeries, medications, any particular injuries or anything like that. So that a lot of people really appreciate that individualized approach.
Yes. That's so helpful. And we've known Angela for a long time. And we've put her classes on our calendars and try to encourage as many people as possible. So it's much appreciated that those are available free of charge. Thank you, Novant. So what kind of issues do people typically come and see you for, specifically around your like one-on-one individual appointments? What are the most common issues people come to you for?
So we definitely see a fair number of people who are experiencing some side effects with chemotherapy. And so we have a variety of different types of options to help people with that. Acupuncture is a really wonderful adjunctive treatment to do alongside chemotherapy, radiation, immunotherapy, any type of conventional treatments for cancer. It can help reduce some of the side effects, particularly some of the GI side effects. We've had some good success with treating and reducing neuropathy, which can be a really debilitating side effect of some chemotherapy agents. It can help improve things like pain, any kind of muscular pain, as well as other sorts of cancer pain, and can help with sleep. So it has a wide variety of benefits. It's really an overall systemic kind of treatment. For most people, or for many people, getting a cancer diagnosis can be a really stressful, emotional experience. And so one of the things that I tend to work with people on a lot is how to address that stress and how to utilize a variety of different techniques to help reduce the impact that stress has on mental and physical health.
Gotcha. So if people know they want to do yoga or acupuncture or massage, can they just schedule that?
Yes, absolutely. They can just call our clinic and schedule that. We we have people here Monday through Friday, actually now. We have a couple of acupuncturists. We have one massage therapist who is certified in oncology massage and is really wonderful. That can be helpful for both physical pain, any kind of muscular issues, as well as helping with relaxation and sleep. A lot of people just feel so much better once they've had some of these kinds of treatments.
I definitely do.
Absolutely, I do
Um,
too.
and then, so if somebody is not quite sure what might benefit them the most, they could come and see you and you can help kind of point them in the direction that they might need
Yeah,
to go.
absolutely. That's definitely one of the roles that I play here is I do sort of a full consult with people and really talk about all the different aspects of their life, all the types of things that they like to do and are interested in doing, and then help make recommendations and suggestions for how they might feel better if they're looking to make changes in certain parts of their life, how they might be able to do that.
It's really helpful. Okay, so you're located at 190 Kimmel Park,
Yes.
which is not at the Novant Cancer Institute. It's actually in the Novant Neurology and Neuroscience building. Is that right?
Yes, exactly. So for people who've been in Winston for a long time, I hear that it was the old VA building. And so that's how some people know it.
Oh,
But yes, it is
yes.
the Novant Health Neurology and Neurosciences building.
Okay. And do people have to be referred to see you?
We like to get referrals because sometimes that helps us get more records, more medical records, so we can be better prepared for each person's visit. But we don't require referrals, so people can just call and make an appointment with us.
Okay. And you've been working as an integrative medicine physician for 3 years, is that right?
Yes, I completed my training a little over 3 years ago and then moved to Winston-Salem to start this job with Novant Health. Um, the Our clinic opened during COVID, and so we've just been kind of growing and expanding since that time and becoming a little bit more well-known throughout the cancer center.
Okay. And do you want to kind of help people understand how integrative, so you're not an oncologist, so you're not talking to people about treatment for their cancer, but you're definitely helping them to deal with some of the side effects that might be coming along with it. Is that right?
Yeah, absolutely. We're a support service and a support clinic for people who are undergoing cancer treatments and or for people who have completed cancer treatments. So we do not take the place of a typical oncologist. We work alongside the oncologists to really help people better tolerate this experience, both mentally and physically.
Okay. So here's a question. We had Dr. Baldwin on a panel for our GI cancer survivorship conference a few weeks ago. And this was a question that I thought was really great that came from the audience. So we'll ask her here so she can answer it for everyone watching as well. Do you think a change in diet or lifestyle does shrink cancer or keep it from growing back without chemo or other traditional treatment?
I think that there are a number of studies that show that eating a wide variety of fruits and vegetables can be a really healthy way to take care of oneself, both prior to, during, and following any kind of cancer diagnosis or treatment. What we tend to recommend to most people is what we call an anti-inflammatory diet, which is not vegetarian or vegan, but very much a plant-focused type of way of eating, style of eating. It's not really a diet in the sense of weight loss diet, but it's more a pattern of eating to just really maximize health. Both cancer and cancer treatments can be inflammatory processes. And so eating in such a way to reduce some of those low-lying levels of inflammation can certainly help people feel better during this process.
But does it treat, it's not a treatment
It's
for
not,
cancer, right?
it's not a treatment. The treatments for cancer would be the traditional treatments that one would do with an oncologist, things like immunotherapy, uh, chemotherapy, and radiation therapy.
Gotcha.
Yeah.
So what kind of advice do you have, since you mentioned lots of people come in for chemo side effects or, treatment side effects in general? What advice do you have for people in terms of managing those?
So there are kind of four main things that we focus on in integrative medicine. Um, Nutrition, as we were just discussing, is certainly one of the main ways to help people, to help ourselves and to help people in general feel better. The other three things are movement or exercise. We find that people who engage in some kind of regular physical activity really seem to tolerate cancer treatments better. It also tends to help with the fatigue that can be associated both with a cancer diagnosis and with cancer treatment. And there are a number of studies demonstrating that it's really the first line intervention for that fatigue that many people experience during this process. We have a few different options for exercise at Novant Health. We do have a free 12-week exercise program called the Cancer Wellness Program that's run with trainers in our facilities. The YMCA also has a similar kind of program called Live Strong, which is again a 3-month, 12-week free exercise program for patients who have had cancer or currently do have cancer. And they offer those in the YMCAs in our general area, and that is for any patient in the area, not specifically for Novant. And again, we've discussed things like the yoga classes that are available, and I will help people find other kinds of other ways to access different sorts of exercise. Techniques, classes, a wide variety of things that are available in the community, because I really do think that's one of the best interventions that helps people tolerate this procedure or this experience best. The other couple of things that we focus on, sleep is the third. I really think getting a restorative night's sleep is a hugely important part of the healing process, and of just feeling better and tolerating treatments better. And then stress and stress management, trying to find the sources in our lives that cause us stress and try to figure out how we can perhaps address those, or if we can't change the sources of stress, trying to figure out how we can better manage the effects of it on our mental and physical health. So learning different techniques about relaxation and how to just help ourselves feel better.
I was wondering, you mentioned mind body. Can you talk more about what does it mean? What does that
Yes,
mean?
absolutely.
Mind body, and then what does that mean in terms of how we help to improve, I don't know, the mind body connection? You can help us understand that better.
Yeah, absolutely. So the main way that stress affects our health is through something called the autonomic nervous system. And that's the automatic part of our nervous system. It controls all the things that we don't think about on a daily basis. So like our heart beating, our breathing, digestion. There are two sides to it. There's the sympathetic fight or flight side, that type of stress reaction side. And then there's parasympathetic rest and digest, or rest and relax on the other side. And I personally believe that most of us in our society are in a bit of a fight or flight state too much of the time. We just have a culture that really prioritizes busyness and doing and producing all the time, and de-emphasizes the importance of rest. When we're in that fight or flight or stress response, our heart rate goes up, our blood pressure goes up, blood sugar goes up, cortisol levels go up. It can lead to a variety of symptoms such as anxiety, insomnia, as well as some physical symptoms of stress, things like headaches. Some pain is associated with that as well. One of the things that I really work with people on doing is trying to learn how to elicit something called the relaxation response, which is the opposite of the stress response, and really brings us back into that rest and digest or rest and relax mode. It's very much a practice in the sense that the more you practice, the more you do it, the better you get at it, and you can really have a big impact on how you feel physically and mentally during times of increased stress. I encourage people generally to have a couple of relaxation practices that they like to really explore a variety of different things. There's meditation. There are things like progressive muscle relaxation, guided imagery, yoga. For some people, repetitive exercise, repetitive movement like exercise or running can be a meditative experience, but really just encouraging people to explore a number of different options that are out there and find the thing that resonates the best with them and what makes them feel the most relaxed and the calmest, so that they are they want to go back to that time and time again, because it does make them feel better.
Yeah, and I think sometimes what we forget is that we probably have like I guess we have a way that we deal with stress that has just become each person's way of dealing with it. And it might not be a healthy way. And then you throw on top of that a cancer diagnosis. And so then you're having to deal with not just having cancer and the stress of treatments, but also that you've learned a way to deal with stress that might not be helping you that much, or might be exacerbating some of the symptoms. And so it's just really hard to unlearn those things or to learn a different way.
Yeah, absolutely. And, I think that oftentimes people will hear in a medical setting that their symptoms are caused by stress, but there doesn't tend to be as much of an educational piece about what do you do about that? Like, yes, we have stress. Yes, a cancer diagnosis is really stressful. And so I can't change the diagnosis, but what can I do to help with that?
Yeah. I think for some people, this is also a good time for you to like accept help because there are so many people that when you do get diagnosed with cancer, I hopefully people have a community who's saying, how can I help? And that by accepting other people's help, that can free you up to maybe explore some more of these ways to rest and relax, and that can be a way that other people can help you, rather than saying, oh, I'm okay right now, or I don't really need, your help, is to just say yes to any offers for help, because that can give you the space to rest if you need, even if you don't think you need to, you probably do need to.
Yeah. And I think that's another piece of this whole experience that I do discuss with people and I encourage them to really think about the things that would actually help them. So if it's that they don't have the energy to cook every night, then, encourage things like meal trains and people to arrange meals. If they have young children, then maybe have their friends arrange play dates for those kids. So, or help with that piece. If they are not able to clean their house or not feeling up for cleaning their house, have a bunch of friends come in and clean their house, but just to really try to think of practical things that would actually help them. I mean, I do think that it's, we give people a gift when we allow them to help us, but I also think that it can be a good idea and best for everyone if that gift is something that's really useful and practical for ourselves as well.
Yes. And I will mention too that caregivers, are often feeling the stress of diagnosis and treatment, maybe not physically receiving the treatments, but as a caregiver, it's a lot. Mm-hmm. And caregivers are they're welcome to come and have an appointment with you, right? And take advantage of the therapies that are available in your clinic.
Absolutely. We are not limited to only oncology patients. I see patients from a wide variety of fields, and certainly caregiver stress can be a lot. And I think that, there's that old adage about putting on your own oxygen mask first. And, we really do have to take care of ourselves in order to be able to take the best care of our loved ones as well.
Yes.
So I think it's all part of
So and your services are available to anyone, regardless of where they're treated.
Yes.
Okay. So, and then if, I think that's just helpful. Do you know, does Atrium also has an integrative medicine clinic in Winston-Salem too? Do they? I'm pretty
They
sure
do.
they do.
As far as I know, they have an integrative medicine clinic. It does not have an oncology focus, but
Okay.
you have an integrative health department. Yes.
And I know that some people have insurance that, you can only go to one or the other. And then some people have insurance where you can go anywhere. So I do encourage people to check their benefits, to see what is available to them. And some people's insurance will pay for massage or acupuncture. Is that right?
I think that that's something that people need to discuss individually with their insurance companies. It is not, it doesn't tend to be covered by insurance very often.
Okay.
So it is usually an out-of-pocket service. The visits with me are covered by insurance, and for most people, again, always double check with your own personal insurance company to make sure that that's the case. But the visit, because of being at Novant and being part of the Cancer Institute, my visits do tend to be covered. But for the other services that we have, there are fees that are generally not covered by insurance. However, we do strive to keep our prices as low as we possibly can. And I do believe that they're lower than pretty much anywhere else in the community for similar types of services.
Awesome. And I will say we do have healing touch and Reiki here at Cancer Services. That's no charge. So you can call and get an appointment on our schedule. And of course, I offer, webinars and cooking classes that are available. So we invite you to take advantage of all the tools that are available to you. This has been so helpful. I love hearing all these ideas and ways people can really take care of themselves during and after treatment. As we close out our topic for today, I always ask our special guests if you could share one piece of advice that you'd like to offer our listeners.
So what I really love about integrative medicine is that it's very old-fashioned and then also kind of a newer area of medicine now. And so I think that listen to what your mother and your grandmother and grandfather and father told you to do when you were a kid. Eat healthy food, get outside every day, move your body, and just take and get a good night's sleep every night. And I know that's an oversimplification, but it also is, they're kind of the keys to really taking good care of ourselves. And, part of what I help people with is making that into a more practical reality, given the realities of day-to-day life.
Yes, that is such a great thought. I feel the same way sometimes, like, oh, you know what? We find lots of different, ways to help you kind of get back to the basics.
Yeah.
So I love that you bring it down to a level that people can really figure out how to work into their day-to-day life. So thank you, Dr. Baldwin, so much for sharing your expertise.
Yeah, thank you so much for having me. I really appreciate the opportunity to be here.
So that wraps up our topic for today. And as a reminder, you can find all of our expert interviews, videos posted on the Cancer Services website, as well as our YouTube channel, and audio over on our podcast, The Triad Cancer Connection. Thank you so much for joining us today. Be sure to stay updated on survivor programs by checking our website for news and be on our email newsletter and social media channels. We hope you all have a great day, and we hope to see you again soon. Take care.
Bye. Thank you.